And then I open this academic session in which Bobby Presley will defend the academic thesis called Pharmacist Services and Medication Adherence in Diabetes Care in Indonesia. A warm welcome to all of you here in the hall, but also, of course, to all those present online, and especially the opponents who are online. Thank you for being here, and I would also like to welcome the two supervisors who will not be mentioned by name anymore, so that's why I introduce Professor Groot. He's a professor of health economics at Maastricht University, and Professor Pavlova, and she is a professor of health economics and equity, and they act as the supervisors of Bobby Presley. But before we go to the defense, I would like to ask you to give a summary of your work, so the floor is yours.
Yeah. Thank you. Good afternoon, dear Prorector, dear member of Corona, families, friend, colleague, and the audience. In the next 15 minutes, I will present the summary of my dissertation entitled Pharmacy Services and Medication Adherence in Diabetes Care in Indonesia. First of all, let me start with the background of my dissertation. As we know, diabetes is one of the most common chronic diseases worldwide, and its prevalence keeps increasing each year, including in Indonesia. Based on patients with diabetes, Indonesia is among the top 10 countries in the world, according to International Diabetes Federation in 2021. Patients with diabetes have a high risk of complications, which can result in disease burden and also potentially increase health expenditure if diabetes left uncontrolled. The high risk of economic burden also can put countries at risk, especially Indonesia that implemented universal health coverage. Medication adherence is an important factor that influences the successful diabetes treatment, besides early screening, the right choice of therapy, and also achieving glycemic treatment goals. The prevalence of medication non-adherence worldwide is still high. Based on the published literature, it's still ranging between 36 until 93%. In Indonesia, the prevalence of medication non-adherence is about 40%. Medication non-adherence can lead to a failure to achieve diabetes treatment goals and increase the risk of complication, mortality, and also increase the risk of hospital care, and also reduce the quality of life for the patients. Healthcare professionals, including pharmacists, have a role in improving medication adherence. Pharmacists are known for their role for medication dispensing. With the implementation of universal health coverage, pharmacists have a role in improving medication adherence, especially with the potential high exposure to the patients. In low and middle income countries, the role of pharmacy services still in transitional role to become more focused on patient care. Therefore, knowing what patient needs from pharmacists and also what kind of services that pharmacists would like to provide can be essential to finding the suitable pharmacy services that valued by pharmacists and patients in Indonesia. 4 research objectives are defined in this dissertation to answer to those problems. The first objective is to review the effectiveness of pharmacy services to improve medication adherence in diabetes care. A systematic review and meta-analysis are used to answer to this question. The second objective is to elicit preferences for pharmacy services to improve medication adherence in Indonesia. A discrete choice experiment is applied to elicit preferences using 16 sets of hypothetical choices. Respondents are asked to choose pharmacy service profile that they prefer. The third objective is to explore patients and pharmacists' ranking of pharmacy services to improve medication adherence in Indonesia. A rank order probit model is used to know how pharmacists and patients rank pharmacy services in the survey, and also find the relationship with the patient socio-demographic. The fourth objective is to investigate patients' and pharmacists' perspective on pharmacist services to improve medication adherence. A qualitative data analysis is used to explore this perspective using open questions. All data collection in this dissertation is conducted in hospital and also community health center. Chapter 2 of this dissertation is designed to answer the first research questions. Through systematic review and meta-analysis shows that combination of educational and behavioral intervention is the most popular pharmacist approach to improve medication adherence among patients with diabetes. Educational intervention can make patients to become more aware of the benefit of the adherence. And behavioral intervention can help patients to become more adherent. This finding also shows that education is still a cornerstone to improve medication adherence and should not be neglected. Consultation, medication review, printed or digital materials, or telephone calls are commonly used to improve medication adherence. This chapter finding also shows that these pharmacy services are effective in improving diabetes treatment outcomes, including medication adherence and other diabetes indicator. But this do not conclude which one is the best suitable one to be applied in practice. Chapter 3 and Chapter 4 of this dissertation are used to answer the second research question regarding preferences for pharmacy services to improve medication adherence. The findings show some similarities and some differences between patients and pharmacists. Regarding similarities, in general, patients and pharmacists prefer to have a shorter consultation duration, a private consultation room, flexible access to pharmacists to discuss their medication problem, and low copayment and free of charge services. Even though patients with experience of getting medication information from pharmacists would prefer to have a longer duration of consultation and also scheduling appointment to meet with pharmacists if they have any problem with the medications. As for, on the other hand, from pharmacist's point of view, providing shorter consultation duration and also flexible access to pharmacists can be more practical. As for low copayment, pharmacists with a higher educational background will prefer to have a fee for services as a reward. There are also some differences in the preferences between patients and pharmacists. Patients prefer a combination of educational and behavioral-based services. On the other hand, pharmacists still mainly prefer educational-based services, even though pharmacists also might expect to provide combination of educational and behavioral-based services. This can be seen in the choice of pharmacy services that they prefer. That patients prefer a consultation in combination with medication review. On the other hand, pharmacists prefer a combination of consultation with brochure. Patient characteristics may influence the preferences. Like for example, a patient with the experience of getting medication information from pharmacists tend not to choose medication review as a choice in combination with consultation. This might be related to the fact that they might even need to wait a little bit longer in the medical facilities to get the medical care and also the medications. Chapter 5 of this dissertation is designed to know how pharmacists and patients rank pharmacy services to improve medication adherence. That found in the chapter 2 and that I already presented. This fifth chapter also shows that consultation and brochure receive the highest rank of pharmacy services to improve medication adherence. This means that direct interaction between patients and pharmacists can be or might be the crucial consideration in choosing consultation as the main or the most common services to improve medication adherence. At the same time, brochure can be a practical way to provide information without consuming more time than other pharmacy services such as medication review. Patient past experience with pharmacists, patient educational background, and pharmacists' perceived potential barrier may influence the ranking. Patients with less year of education and older patients tend not to choose a brochure to improve their adherence. Chapter 6 of this dissertation describes the perspective of pharmacists and patients on pharmacy services that can improve medication adherence. This study chapter shows that most of the respondents stated that do not need any help from the pharmacist. Limited understanding of pharmacists' role is one of the main reasons behind it. As in Indonesia, pharmacists are known for their role in providing medication and also medication dispensing. Another reason is the satisfaction with the current services, as the patient might do not know what kind of other services that pharmacists can offer to improve medication adherence beside dispensing. This can be seen in one of the quotes from the patients in the hospital stated that, "If I'm not feeling well, I will contact and communicate with the physicians. Then the physicians will change the medication, not pharmacists. Pharmacists only provide and give the medications." Similar finding also found in the previous chapter that consultation is the most common desired pharmacy services. One of the quotes from pharmacists at the hospital state that, "By providing consultation, patient will understand their condition and more adhere to the medication. Patient will know how the medication works, when and why the medicine should be taken. By having that knowledge, we expect patients will be more adhere to the medications." This study chapter also identified the barriers from pharmacists' point of view to implement the desired pharmacy services, such as limited number of pharmacists in each medical facilities, including community health center and hospital, and also high workload of pharmacists in practice. This can be seen in one of the quotes from pharmacists in community health center that said, "We have many responsibilities to provide the report to the activities, the medicine management, delivery of medicine stock from the government, administrative function using simple software. Therefore, it is impossible to ask us to provide more intensive services." Based on the finding from this dissertation, some suggestions for policy and research can be made to support the role of pharmacists in patient care, especially in improving medication adherence among patients with diabetes. First, the need to reevaluate the ratio between pharmacists and patients in medical facilities. As stated in Pharmaceutical Care Standard in Indonesia, the ratio should be 1 pharmacist for 50 ambulatory care patients. But in practice, 1 pharmacist needs to attend more than 100 patients a day. Taking a new task in improving medication adherence will further increase the burden unless the ratio is reduced. Second, the need to identify and evaluate the pharmacist's workload in practice to optimize the role of pharmacists in patient care. As found in chapter 6, that many responsibility in dispensing, administration, procurement, and also providing care to the patient can hamper the active involvement of pharmacists in patient care. Third, the need to evaluate the current pharmacy services and whether they are already accommodated with the patient needs, especially in improving medication adherence in diabetes care. Fourth, raising awareness of privacy matter can be important to build trust between pharmacists and patients. This is supported by the finding from this dissertation, especially regarding the need for private consultation room or area. Ensuring such room is available in each medical facilities can help to improve patient-pharmacist relations and also support the role of pharmacists in medication adherence. Thank you for the time for the presentation. I will give it back to the prorector.
Thank you very much for this summary of your work. Then we proceed to the real defense of this, and the first question will be asked by Professor Scholz. He's a professor of old age medicine at our university, and he was the chair of your assessment committee, and today serves as the secretary of this degree committee. Professor Scholz.
Thank you, Prorector. Dear candidate, my compliments for your scientific work, and of course also my compliments for your supervising team. Your thesis is about the role of the pharmacist in diabetic care and medication adherence in Indonesia. Has been nicely written, and the layout is nice as well. I'll come back to that soon. The thesis focuses on an extended role of the pharmacist beyond simply providing medication to patients, and this role may even involve more close patient contact, more close patient management support and coaching. But in your introduction, you give some reasons for this more close involvement of the pharmacist. But my overall first question is, why didn't you elaborate in your studies on combined support of the pharmacist and the physician with regard to stimulating and controlling medication adherence?
Okay. Highly esteemed opponent, thank you for the compliment and also the questions. Yeah, regarding the question for the role of pharmacists and also patients in delivering care for the patients, in this dissertation, I'm focusing on how to know what kind of suitable pharmacy services to improve medication adherence. Yes, that it is true that for providing care to the patient, we need to collaborate with the other healthcare professionals, including physicians in this case. And then might be the future one that in this dissertation, I'm focusing on how, from the point of view of pharmacists and patients, on the suitable pharmacy services, but from physician is the next step. So after we knew about the pharmacy services that pharmacists and patient want, we will try to inform the physician and try to collaborate whether it is possible to delegate some of the job or the description about what to do by pharmacists and what to do by physicians.
I know it's your next step, but I especially ask is, if you look to your nice book,
yes,
then it looks like that the front shows the prescribing doctor, and the back shows the pharmacist and the patient who just have to figure it out afterwards.
Yes.
So that's the impression it makes. So why taking into account the role of the physician in the next phase? Because if you look to the preferences of the patients, they said we want consultation of the pharmacist and also in the same time a medication review. Couldn't that be the basis for a more triadic interaction between physician, pharmacist, and patient? Shouldn't that be the strongest focus in the future?
Highly esteemed opponent, thank you for the question. Yes, that's really true. I'm starting with the pharmacists and patients because in Indonesia there is no consensus on which pharmacist role that can be implemented in the practice. And then the problem with Indonesia is also the perspective of physicians not always welcoming the pharmacists and not always accepting the role of pharmacists in patient care. So we would like to start with this dissertation to know what pharmacists can offer and also what a patient would like to have from pharmacists. So hopefully from the input from both perspectives can also help to discuss with the physicians on the role of the future between pharmacists and patients in providing care to diabetes patients.
I admire that you stick to your thesis, of course.
Yes.
But you also, another related question is that diabetes patients are regularly checked by other healthcare professionals also.
Yes.
And for instance, home care, nurses, etc., etc. What role should these professionals play in improving medication adherence?
Yeah, so thank you, highly esteemed opponent, for the question. So the role of pharmacists in here, it's much more to help and empower patients to become more adherent to the medications. Of course, this is not the responsibility only for pharmacists, but also the other healthcare professional, and they have their own role on providing improvement in medication adherence. And for pharmacists, it is focusing on how to monitor and also identify if they have any medication problem with the patients, including if they have any problem with the medication adherence. They will know that, okay, pharmacists as one of the healthcare professional that provide a lot of contact with the patients can also identify if they have any problem in the medications. So hopefully, pharmacists can also help educate and monitor how patients use the medication. Mm-hmm. That's the role of pharmacists. And also one thing that I would like to emphasize in here, that we try to provide the role of pharmacy services without any intention to change the role of physicians. Okay. So that's the one that make a little bit of challenge in practice, because sometimes a physician thinks that some of the activities from pharmacists is almost the same like the physicians.
You nearly have become a politician also. I from another recent Indonesian study yes. done by one of my own PhD students. He is in the audience.
Yeah.
I learned that this was a study about pressure injuries, and it became clear that even under the universal health coverage system regime, you also talk about in yes. your the access to formal care is not always guaranteed for patients.
Yeah.
And with regard to your study, that brings me to the role of informal carers, the role of the family. Yeah. What's the role of the family in contributing to getting a better medication adherence?
Yeah, thank you, highly esteemed opponent, for the questions. So the role of family is also big as a support for the patients with diabetes to become adherent to the medication, because sometimes in practice, patients not always come to understand the information provided by the pharmacist. So sometimes one member of the family always accompany them to go to the pharmacist, and they would explain to the family about the medication, about how do they take the medication and the importance of medication adherence. So the role of family to support in medication adherence is a big
so
support.
In fact, it's a multidisciplinary approach.
Yes, yes.
Do I have still some time or no? May I have a short last question? I want to ask one of your paranymph to read proposition 9.
Okay.
For me. Is that possible? Yeah?
Okay.
So proposition 9, making changes too drastically can be frustrating and challenging, while small changes may be critical for drastic reforms.
So dear candidate, after our discussion until now, what's the first small change you are proposing to execute in the pharmaceutical services in Indonesia tomorrow?
Okay, the small one will be, in practice, the more practical way is to choose which patient that should be provided with the services, because in Indonesia, as I mentioned in the previous chapter also, that many responsibility that pharmacists need to attend, and also the ratio is not really balanced. So the practical way to do that now is to choose which patient that should be prioritized, and then provide the services on that patient first. And then if the next step will be the assessment for the workload for the pharmacist to provide the services.
So I understand not calling the physician. Thank you very much. I give to
thank you.
You must understand that Professor Scholz is a physician himself.
Yeah, sorry.
For the next question, I turn to another member of the assessment committee, and that's Dr. Dwiendarti. She is present online, and she's an associate professor and lecturer in pharmaceutical management and social pharmacy at the University of Gadjah Mada in Yogyakarta. Please take the floor.
Okay, thank you, Director. Dear candidate, firstly, I would like to congratulate you and the supervisor team, your family and friends who support you for your achievement in this PhD study. Your thesis is very interesting and important for science and also for practice in improving patients' health. I'm also impressed for many publications that you produce related to your thesis research. And my questions are, the first, in chapter 3 to 6 of your study, involves study participants living in Surabaya. It is one city out of many more residents in Indonesia. As we know that Indonesian population is big and consists of various socio-demographic background. Hence, the characteristic of diabetes patient would also vary. In your opinion, would it give the similar results if the study conducted in other population in Indonesia? And what considerations should be made for implementation of these programs to improve pharmacy services and patients' adherence in diabetes care and various background of diabetes patient in Indonesia? Thank you.
Esteemed opponent, thank you for the compliment and the questions. Regarding the question whether it is possible to be generalizable for the other population, yes, from this study, we took the data collection in community health center and hospital. For this, the result from this study is generalizable only on a community health center that have pharmacists in the facilities and also including in the hospital. But the problem if we ask whether it is implementable for the other hospital in Indonesia, there is one limitation of this dissertation that all of the hospital that involved in here have a connection with the education institutions that rarely might be available in the other rural area. For the urban area or urban area, it's not going to be a problem. But if we ask about the rural area, it's going to be a lot of challenge, and might be there be a differences with the preferences of the pharmacy services. As for the example, for in here, we took Surabaya as one of the sampling in here because most community health center in Surabaya already have pharmacists, while in the other community health center in the area outside of Surabaya, not all of them have pharmacists. So it's gonna be a lot of challenge to implement this rule in the area that do not have pharmacists, because even though they have pharmacists in medical facilities, including community health center and hospital, they still have problem to implement their role in patient's care. So it's going to be a challenge for that one. And then for the second question regarding what should be done to implement the finding of this result, as I mentioned in the suggestion of our policy and research, I think the first thing that need to do is to evaluate the ratio between pharmacists and patients, because it is practically difficult and also a little bit impossible to provide a lot of services in patient care if the ratio is not balanced. Like for the example, during my data collection, one pharmacist need to attend more than 100 patients a day. And then that's why in practice, pharmacists usually only provide information or consultation in small or brief information to the patients and not really focusing on patient care. And then after evaluating that one, we need to also evaluate the current practice for the pharmacists, because the question will be like whether they already meet with the patient's need in practice, because mostly the patients in Indonesia receive the information provided by the pharmacists. They do not have any choices to reject the services that are provided by the pharmacists, because they used to listen to every healthcare professional say about their condition. Yeah, I think that one. And then connected with the implementation, like the previous question from Professor Yuskul about the role of pharmacists that we can do, the easy way will be choosing which patient that should be prioritized on that one. Because as this diabetes care is not the responsibility of only for pharmacists, but also other healthcare professionals, including physicians. And this dissertation can help to build a bridge to communicate and also collaborate with the physicians about the needs from the patient for the pharmacy services. Thank you.
Thank you. One more question. Regarding the preference of co-payment or fee for service, both patient and pharmacists prefer lower co-payment, not a zero payment. Yeah? I think this finding is good, and this finding also shows an inline idea between patient and pharmacist. However, in the context of Indonesian universal health coverage, as we know that the health payment system does not apply a co-payment So for the implementation of the program to accommodate the co-payment, what is your suggestion? What scheme should be applied for the co-payment of the service?
Thank you for the questions. So regarding the low co-payment or free of charge services, yes, in Indonesia, there's various consensus on how much the fee that should be paid by the patient for the pharmacy services. Because based on the universal health coverage, the component for services from pharmacists is not yet established. So in practice, there is some area that implemented, if you want to add more services from the pharmacists, you can pay extra money that you need to pay out of the pockets. But I think at the beginning of this role of pharmacists, I mean also to promote the role of pharmacists, I think you can start with providing the services without any charge, I think, at the beginning. And then if they already feel the benefit from the services, we can add more fee to the services, I think. Yeah, thank you.
Okay, thank you so much.
Yeah, thank you.
That's enough for me.
Okay, thank you, Dr. Endarti. I turn to another online contributor to this discussion, also a member of the assessment committee. It's Dr. Ajib Prayitno, and he is an associate professor and lecturer and the head of Magister Pharmacy at the University of Surabaya, that you know very well.
Yes.
And that, of course, is in Surabaya. The floor is yours.
Dear chairs and candidates, congratulations, Mr. Bobby, for your achievement in completing your thesis with title Pharmacy Services and Medication Adherence in Diabetes Care in Indonesia. My question is, according to the 10th International Diabetes Federation Atlas 2021, there were 7.3 million number of people with diabetes in 2011. But 10 years later, in 2021, there were 19.5 million, more than 2.5 times increase in the last 10 years. This figure also raises Indonesia's position from 7th to 5th in the list of countries with the highest number of people with diabetes in the world. This figure will continue to increase if there is no intervention. Thus, diabetes can be seen as one of the national health problems as it contributes to the high number of morbidity and mortality. This is particularly a concern in the background of limited health workers who handle diabetes care in Indonesia. Not to mention, many Indonesians are unaware that they have diabetes. In this situation, what do you think the finding in your research can help to address these problems?
Esteemed opponent, thank you for the compliment and the questions. Regarding the question to the high increase of the prevalence of diabetes in the world, including in Indonesia, nowadays become the rank 5 in the world. The result from this dissertation is not directly effect on the reduced number of patients with diabetes, but through this finding of this dissertation can provide information about the dangers of diabetes mellitus, including in here the focus will be in medication adherence. Pharmacists have a role also in reducing reducing the prevalence of diabetes in the world. Even though the role is not directly to reduce the number of patients with diabetes, but more like giving education to the patients, also the family, on the dangers, on the impact of diabetes if it is left uncontrolled. So based on the finding of this dissertation, pharmacists can also provide education to the patients and also to the family of the patients. So in here, they will also provide education and what is the dangers, what is the important things that patient with diabetes can impact or not only in disease burden and also potentially increase the health expenditure. So through that impact on the patients, they will know how pharmacists can help to not directly reduce the number of patients with diabetes, but make them more aware on the impact of diabetes if it is left uncontrolled. I think that's the
And the second question is, what do you think would be the novelty of your thesis?
Okay, yeah. Esteemed opponent, thank you for the question. So based on the novelty of this finding, of course, in Indonesia, the methods that we use in this study is rarely used in Indonesia. So I try to find other research to compare the result between the DC, for example, the DCE, the discrete choice experiment that we use in this study. I cannot find any other research about this one. And through this discrete choice experiment, especially to elicit preferences, can also help us to identify which pharmacy services that they prefer that valued also by patients and pharmacists in Indonesia. I think one of them are the discrete choice experiment. And through this finding, we can also find out that from patient and pharmacists, they have their own preferences on the type of pharmacy services. And in practice, as I mentioned previously, that in Indonesia, most of the patients are accepting any services that provided by the pharmacist without any freedom to choose which one they would like to have. So it's going to provide more insight to the patients and also for pharmacists that patients have preferences on the services that they want from the pharmacist. Thank you.
Thank you, Pak Bobi. Another question is, this dissertation looks at patient needs and preferences and suitable pharmacy services which are met, once again, which are met with patient needs and preferences. In addition to the met needs or preferences, how do you think about the unmet needs and preferences? Do you also identify the unmet needs and preferences?
Opponent, thank you for the questions. Yeah, regarding the unmet needs for the patients, yes, it is not really the focus of my dissertation, but yes, it's going to be really helpful in the future to identify the unmet need from the pharmacists. In this dissertation, we only able to identify what patient needs, but we did not specifically address the unmet needs for the patient regarding the services that pharmacists would like to provide. So yes, it is going to be really important in the future to also combine the result from this dissertation, especially on the preferences, and also whether it is also meet with the unmet condition from the patients. As in Indonesia, for the pharmacist role of pharmacy services is not always a lot to be do the research in this matter, especially also to identify what pharmacists or patients need from pharmacists. So hopefully this is one step that need to be done at the beginning. To start for the next one would be to identify the unmet need from the patients and pharmacists. Then we can make a complete picture on what is patient needs from the pharmacists, especially for the practice in Indonesia. Thank you.
Okay, thank you, Pak Bobi and Director.
Okay, thank you, Dr. Prayitno. I turn to yet another member of the assessment committee and also the third online opponent, and that's Professor Jore, and she's a professor of health technology assessment and decision making in our university. So, Professor Jore.
Thank you. Dear candidate, first of all, my congratulations to you and your family and friends and your supervisors for this relevant and extensive work to identify suitable pharmacist services to improve medication adherence among patients with diabetes in Indonesia. I do not think I've ever seen a qualitative study with this many participants before, a staggering number of more than 900 persons. So I can only imagine how much work it must have been to collect and analyze all those data. And I'm sure you're happy now that's all nice in your book and published work. I wanted to ask you a question about the reasons for non-adherence with diabetes medication. In your introduction, you state it's almost 40% of patients, which is very considerable. And I was just wondering what are the reasons? I do not know the healthcare system in Indonesia very well, although I know, because you told me, there is universal health coverage. But for instance, are there any co-payments for medication or consultation or the long waiting times that might cause an issue with access to care? Or do you not think that access to care is a factor of influence on the non-adherence?
Highly esteemed opponent, thank you for the compliment and the questions. Regarding the question for your question, so in Indonesia, in practice, pharmacists provide the services to the patients, but there is no consensus regarding the medication adherence, specifically what kind of services that pharmacists should provide. And then regarding about whether it is influenced the medication non-adherence for the patients in both medical facilities shows that yes, pharmacists still in transitional role in Indonesia to be focused on patient care, including the role in medication adherence. And for the fee for services or local payment, in practice, pharmacists provide the medication information and also the services is for free. Especially the standard information that they provide are general medication information, like for example, related to medication administration and also scheduling for the medications. And not really like a consultation that have a direct interaction between patients and pharmacists. It's more than like a pharmacist that being active to provide the informations. So that's related to the local payment. So in the universal health coverage, there is no scheme for the fee for services for the pharmacists. So at this moment, the fee for services for the pharmacists only related to providing and medication dispensing. That's one of the problems related to the pharmacist role in Indonesia. So, and regarding for the access to the pharmacists, at this moment, yes, pharmacists with the implementation of universal health coverage, every patient need to go to the community health center before they need to be referred to the hospital if they have any complications. So at this moment, the access for the pharmacists have a high potential exposure to the patients. In this case, it means that a patient can develop and have an opportunity to develop their role in patient care. In this study also found that, like for example, the flexible access and also picking out appointments, like in general, patients tend to prefer like walking in services. So when they have a problem, they come to pharmacists. But in practice, it's gonna be a little bit difficult. For example, if they want to have like scheduling appointments to meet with pharmacists to discuss, as I mentioned previously, that a lot of barriers, including how pharmacists need to attend more than 100 patients. So it's going to be a lot of challenge to choose which one, even though from this finding of this dissertation, in general, patient would prefer to have a flexible access. But from point of view of pharmacists, providing a flexible access can be more practical because they come and then give the information and the services and then finish. They do not need to provide another specific time to discuss their medication problem.
Yeah, I understand, and I think you lay that out very well in your thesis, that there are barriers for pharmacists to provide those consultations to improve adherence. But for instance, do you think there are barriers already for patients to simply acquire their medications because there are long waiting times, or are there any other barriers that might lower adherence to medication apart from educational and behavioral interventions?
The one that also to influence the medication adherence that also found is also they tend to forget their medications, and also they lack support from the families to remind them to take their medication is also one of them. And also the one that might also not be pictured in this dissertation is the health belief of the medication and also the condition of the disease of diabetes. So when we ask about medication adherence in this dissertation, we only we only ask them whether they are feeling or perceived to be adhere or not with the medication. I think to make them more quantify, I think we need in the future to also measure the medication adherence using a specific tool, so we can corroborate with the finding that a patient that feel to be adherence with the medication, is it adherence or not according to the belief and the perception.
Yeah, I think that's an excellent idea. It's something that struck me as a bit odd, that there is this majority of patients who do not see a role of the pharmacist and who see themselves as adherent, but at the same time they possess certain preferences for pharmacists who have those adherence boosting interventions. When you now look at your results, and mainly the results in chapter 6, do you feel those results are generalizable to the whole population of diabetes patients, or are those results mainly generalizable to the population that sees a role for the pharmacist?
Highly esteemed opponent, thank you for the questions. Whether it is generalizable for the other population, I think for the patients and also pharmacists, they have a similar background of information, and also the real situation in practice is almost the same in area in Indonesia. So, for example, the patients in here that come to the community health center and also hospital have a low educational background, for the example. And then this might also be found in the other area of Indonesia. And then this is going to be a problem if it is happen in the rural area, because in this case, we use the sample community health center and also hospital in urban area. So there might be a little bit of difference, but in general, the population is generalizable for the patient and pharmacists in Indonesia, because the situation can be similar. Yeah.
But do you think that the population that sees themselves as adherent and does not see a role for the pharmacist, do you feel that that is true, or do I now understand you correctly that you feel that that might have been kind of a socially desirable answer, but that there is in fact also in that population a lack of adherence?
So for the role of pharmacists, yes, I think that's the biggest problem in Indonesia, whether the patients in Indonesia know the role of pharmacists. So that's, I think, become a common knowledge that in Indonesia, there used to be the practice that pharmacists only are providing medication and also medication dispensing. So to change the mindset of the patients about the role, the new role of pharmacists in patient care, it's going to take times and also an effort to promote their roles one by one in practice. So that's why I think that's one of the common challenges that found in this dissertation, and I think it is almost the same happening for the patient in Indonesia.
Can you elaborate on that last? What is the same for the patient in Indonesia?
Yeah, so the same thing will be, so I mentioned that patients do not really know or have limited understanding on the role of pharmacists. So I think that would be similar for most of the patients in Indonesia, because the first thing that you can find that not pharmacists provide the patient care. So in practice, some of them are only providing the standard care, only providing the medication, and also give the medication. Some of them are providing the role of inpatient care. So that's why it's going to be challenging to make them, every pharmacist, to make them to do the role in patient care. I think that's the similar problem that could be found in Indonesia.
Thank you for your answers. I give the word back to the co-rector.
I then give the floor to Professor Maarse, and he's an emeritus professor of health policy analysis at our university. The floor is yours.
Thank you, dear candidate. First of all, my compliments for your study, and I also include your two supervisors. This is a rather new topic for me, but I found the study very interesting. And I heard you saying that a pharmacist sees a day around 100 patients. Is that correct?
Yes.
And the norm is 50.
Yeah, the normal ratio, should
well,
be.
This is you can't see 100 patients a day. But a simple solution could be that you teach pharmacist nurses, so specialist nurses, who do a great deal of the job of the pharmacist. After all, it is standard care. So why you are all the time talking about pharmacists, but the title of the book is about pharmacist services. And pharmacist services can also be delivered by other people than the pharmacist. So let us call these people specialist pharmacist nurses. So do you see is there any potential for that in Indonesia?
Oh, okay. Highly esteemed opponent, thank you for the question and the compliment. Yeah, regarding the question for that one, yes, the focus will be on pharmacist services, yes. Pharmacists as the people that gonna provide the services, yes, and I agree that to promote the services to the patients, we need to look based on each healthcare professional roles in providing care to the patient with diabetes. And in this case, pharmacists will be the focus of my study. And then, of course, like for your example, mentioning about the involvement of nurse and also the previously with the physicians, I think that will be the future collaboration with the pharmacists and also with the patients, and also between physicians and also nurse.
May I ask you, could there be some resistance among pharmacists that these specialized nurses are doing this kind of work?
Do you mean the comment from the
resistance from the of the pharmacists? Because it means that a great deal of their work is now being transferred to other healthcare providers.
Okay.
I ask this because I know from other countries that there is some resistance there, because it can also can have financial consequences and whatsoever.
Yeah. I thank you for the question. So I think there. I'm not really sure about that one. But when I was doing my data collection and I have an interview with the pharmacists might have the problem. They still also difficult to define which role that should be done by the other healthcare professional. Like for example, if we talk about the specialized nurse function in here, I think the one that we need to be done is to specifically define which role that can be done by pharmacists and which role can be done by the nurse. And that's, I think, is not always going to be...
It's a sensitive issue.
I think that's going to be a sensitive issue.
Yeah. I have also another problem to discuss. I want to discuss another problem, and it is about chapter 3 and chapter 4.
Yes.
Where you do a study with discrete choice experiments. And this is not about revealed preferences, but about stated preferences. And now my question is, how do you judge the validity of the results based upon a discrete choice experiment? After all, I mean, stated preferences in general, they may be unstable, ambiguous, context-bound, whatsoever. And this is about stated preferences, not about revealed preferences. So my question is, how do you judge the validity of the results? And I ask this, I cannot say it, because in the survey, I found that more than 60% of the respondents said to have no desired preference. So how can I combine these two results?
Yeah, highly esteemed opponent, thank you for the questions. So regarding the finding between chapter 3 and 4 and also chapter 6, yes, in chapter 3 and 4, I used the discrete choice experiment to elicit the preferences. Yes, regarding the validity, yes, there is some limitation, of course, because in this discrete choice experiment methods that we use, we do not include the opt-out option. That might be influence how the patient or the pharmacist to express their choices.
But that
in
could
preferences.
mean that the result is also a little bit artificial.
No, for this result, I think because we put and force the patients and pharmacists to choose the one that we already provided, so might be provide information if they only need to choose the services that provided in the choices. But the result in chapter 6, we put like a freedom, give them freedom.
Yeah.
If we gave them like what kind of services that would like to have, and then they can choose whatever the services they would like to want. And then, yeah, in this situation is a different interpretation on that one, because in the first one, in the DCE, yes, we didn't include the opt-out option because we are afraid that people tend to choose if we put the opt-out option, and then they will choose the opt-out if they make a difficult trade-off on the attributes on the profile of the pharmacy services. So it's going to be a challenge there. That's the one consideration at that time, not to include the opt-out option. But I think to better give a better picture in the future, I think to make it the same with the finding in chapter 6, I think, yeah, inclusion the opt-out option will give a more complete picture on between the two results on this chapter.
Yeah, actually, I found it a little bit difficult to combine both results. But let's leave this point. I have, if I am allowed, I have a comment on your proposition number 9.
Number 9, yes.
Yeah, I will read it. Making changes too drastically, you say,
Yeah.
can be frustrating and challenging, while small changes may be critical for drastic reform. That was the proposition that has been
Yes.
referred to by
Yes.
the first opponent. I would like to comment on this, because if you are talking about small changes, I would have added into the right direction. I mean, this is one point. And the other point is, and that is the risk that small changes may also end up in muddling through. So that important changes which should take place don't take place because all the changes are marginal, and you are defending the marginal change. So at least you should add into the right direction, because a number of small changes into the right direction can have a transformative effect. But I have a question. That is about proposition number 10. Can somebody read that?
All right, proposition number 10. An agent of change does not always follow what is perceived as the norm.
This needs some explanation.
Thank you, highly esteemed opponent, for the question. So regarding the proposition number 10, so it means like, for the example, pharmacist role in Indonesia still developing to choose to be more focused on patient care. And then if they want to make changes, you cannot just say that, okay, the standard pharmacy services in practice should be providing consultation or counseling, but only brief information. If you want to make changes and then to want to make your role or of profession to be known by the other, you should be focusing on what can you do. You need to make the small changes. I mean, did that different.
But that's not absolute, so you can finish your answer shortly.
Okay, so for that one, you need to make something different from the other profession in the same to make it specifically or unique for yourself. So that's why I made that proposition.
I'm afraid,
Thank you.
Professor Maastricht, that you can't react to this anymore because Horace has been called out, which means, Mr. Bobby Presley, that the time appointed for the defense of your thesis has now passed. And the degree committee here and also online will withdraw to discuss the quality of the thesis and the defense. And then I would like you and your company to await the results of this deliberation in this hall. And thereby I adjourn.
Thank you.
The PhD defense has now ended. The degree committee will debate the candidate's performance behind closed doors. This process usually takes about 10 minutes. In the meantime, let's take a closer look at Maastricht University's renowned teaching method, problem-based learning. Once the pro-rector reconvenes the session, we'll tune in and continue the live stream.
Problem-based learning, or PBL. What does that mean exactly? 3 of my fellow students and I will show you around.
Every week, we analyze a different case or issue together. We discuss the case and everyone can contribute different perspectives to the group discussion. If we get stuck, our tutor helps us out and suggests what we could do next. I prefer going to the library to prepare. Here, I can focus and I have quick access to books or journals that help me understand the case. Today, I can also train my stitching skills in the Skills Lab, where you can immediately put into practice what you've learned. After a day like this, I like going to the gym to clear my head and get ready for the next day.
At UM, you meet people from all around the world. Hello guys. Some of them are doing their exchange semester here, and they often say that PBL helps them learn and retain things very easily. I can understand why. It's a very active way of learning because you have to bring your own perspective to real-life cases. You have a lot of freedom to manage your time, your studies, your hobbies, and your work. Of course, that also means a lot of responsibility. Right now, for example, I'm arranging my exchange semester in Madrid. How cool is that? In this group session, we're the managers who have to allocate the resources of a real company. This is how we put into practice what we learned this morning. Studying here means being proactive and learning to plan well. Prioritizing and performing well under stress are great skills that help you develop as a person. But now, it's time to grab a coffee at the Student Service Center.
Right now, we're at the Brightlands Camelot campus. Here we can apply knowledge from lectures and tutorials in a practical setting. This helps us understand what we have learned and further develop our lab skills. Today, we're determining the amounts of cholesterol in various products. What I really like is the project periods at the end of each semester, where we complete a full research project that includes planning, collecting data, analyzing, and presenting the findings. That way we learn how research works and we're able to see what it's like to be a real scientist. After practicals, I have to write a lab report that also helps me process everything I have learned today. UM has a lot of learning spaces where you can work on your own or with other students. This evening, I'm meeting my friends for a movie night organized by the MSP Study Association.
If you study law, you have to read quite a lot. Not all information is relevant, so you learn how to easily find the information you need to solve your case. In the afternoon, I have to give a presentation, so I like to practice it with a fellow student. Later today, a lawyer is giving a lecture. This will help us better understand the case we're working on. Speaking in front of a group is quite exciting the first time round, but you get too used to it quickly. And having to present helps you also to adopt knowledge better. What I like the most is that we sometimes get to enter a plea in front of a real judge. These moot courts are really exciting. Now it's time for drinks with friends. Studying is important, but so is relaxing once in a while.
Who are we as a UM community? We are a group of people who love,
talk,
move,
learn, work and think in a variety of ways.
And we all want to be a valuable and valued member of our UM community.
a community where everyone can feel safe, needs nurturing.
To bring a community to its full potential, we all have a role to play.
Every single one of us needs to be part of a moving conversation.
To understand each other.
To find help if you need it. Or to give help when asked.
To connect with your peers and share some stories.
And have some fun at the same time. Make space for new perspectives and broaden your horizon.
Discuss. We don't have to agree, but we can learn.
That diverse views are at the basis of our understanding.
And including these views are the basics of a healthy community.
Make a difference at your own pace.
Join one of our active groups or become an ally. The first steps are not always easy, but let's help each other on this journey.
Do you want to know more? Follow the UM's Diversity and Inclusivity Office on social media.
Or check out maastrichtuniversity.nl/diversity.
Mr. Bobby Presley, the degree committee here present has assessed the quality of your thesis and the way you just defended it. And in view of its positive verdict, and of course taking into account previous qualifications, the degree committee has decided to grant you the degree of doctor, which means that Professor Groot, your supervisor, is authorized to confer upon you this academic distinction in conformity with Dutch University custom. I invite your supervisor to take the floor.
Do you promise to work in accordance with the principles of scientific integrity at all times, to be careful and honest, transparent, independent, and responsible?
Yes, I promise.
By the authority vested in us by law and in conformity with the decision of the committee here present, I hereby confer upon you, Bobby Presley, the degree of doctor and grant you all the rights attached to it by custom and law. As evidence of this, I now present you with the degree certificate signed by the rector, the secretary, and the other members of the committee and affixed with the official seal of the university. Dear Dr. Presley, dear Bobby, it gives me great pleasure to be the first to congratulate you with your PhD. I also do this on behalf of Milena. I speak for the both of us when I say that you have done a fine job and you have written an excellent dissertation that makes a great contribution to science. It was also a pleasure to witness your defense of your dissertation, which you conducted yourself very well. It's been a great pleasure to work with you and to supervise you doing your PhD research. The shine of your dissertation and your defense today also shines a bit on us. We are very proud of your achievement. As I said, you have written an excellent dissertation that has increased our knowledge and insight on interventions that improve medication adherence among diabetes patients. Your results show that these interventions are generally quite effective. This is an important insight, as lack of medication adherence not only can have serious negative health consequences for diabetes patients themselves, but also leads to higher healthcare costs for society as a whole. Improving medication adherence is one of the best ways to save both money and lives. Your dissertation shows that patients and pharmacists also largely agree on what interventions they prefer. Fortunately, these also seem to be the most effective interventions, although one intriguing result from your study, as already mentioned during the opposition by Professor Jora and also Professor Maastricht referred to it, is that around half of the patients say they do not think they need any interference by the pharmacist to improve their medication adherence. Some of these patients may use their medication as prescribed by the physician, but it may also be that there is a need to improve awareness about the importance of medication adherence and the role of pharmacists may play in this. Like in many other countries, including here in the Netherlands, most patients still see their pharmacist mainly as a dispenser of medication and not as a caregiver. You have written 5 papers, 4 of which have already been published in good academic journals, and the 5th one will follow soon. This is a great achievement, considering that you also collected all the data for your dissertation yourself by surveys and interviews among patients and pharmacists in hospitals and primary care centers. You also applied some sophisticated econometric techniques that are not standard issue in most dissertations. Your dissertation also applies a range of research methods, from statistical analysis on survey data to qualitative research methods on interviews and a systematic review and meta-analysis. You have developed yourself in an all-round and experienced researcher. What is also important to mention is that you achieved all of this in 4 years' time. You came to Maastricht and started your PhD research in 2017 and finished your dissertation by the end of last year. Given your research output, it is a great accomplishment that not many PhD candidates are able to match. We have a tradition that we end the laudatio by citing some appropriate poetry. I've chosen a poem by W.S. Rendra, or Rendra, as he's also known by. W.S. actually stands for Willebroeders, that also refers to the, let's say, the historical ties between the Netherlands and Indonesia. Rendra is known for his lucid and simple poems with an effective use of words. He was nominated for the Nobel Prize a number of times. The title of the poem is Emptiness is Full of Power, and I've selected it because it's intriguing and I believe in some respects fitting. The poem reads like this. Habit is not a personality. Personality is also not a delusion about yourselves. Personality comes from emptiness. When we are empty, we're agile and alert. In emptiness, we can respond to anything, according to the circumstances, and not based on habit. The full are rigid and lumbering, often even have no power. The empty are in fact full of power. Your personality, Bobby, is always cheerful. Every time we meet to discuss another draft of one of your papers or the revisions we have to make on behalf of a journal, your cheerfulness and enthusiasm brought a smile on our faces and brightened our days. You also never seem to tire of going over another set of comments and revisions. Even though during the corona pandemic, like so many others, you found it difficult to be confined to your house. You were also one of the first to rush back to the office when there was a chance to do so, because you missed being able to meet with colleagues and friends, and you also missed the opportunity to travel home again. For expats like you, the lockdown measures during Corona were especially hard-hitting. Despite this hardship, you remain cheerful and optimistic. The emptiness that Rendra mentioned refers to openness. Openness to new ideas, to learn new things, and then in your first paper, and all of the papers in your dissertation, you learned new things and applied them in your studies. In your first paper, you applied a random effects regression analysis in your meta-analysis, a new technique for you. You repeated that in the third paper, where you applied a recently developed econometric technique to estimate rank order variables, where the ranking is on one item is correlated with the ranking on another item. Again, this was something completely new, but you approached it with enthusiasm and a willingness to respond to anything, as Rendra says. In the words of Rendra, you responded to the circumstances, and you did so not based on habit. We hope that you bring your research skills to the University of Surabaya, where you work, and hopefully be an inspirator and mentor for other young and aspiring researchers there. I think you would be good at that, because one of your powerful personality characteristics is that you're a great team player. You very much enjoyed our weekly meetings, I believed, in which you could discuss with us what you have done during the week, the problems you had encountered, and what you plan to do in the upcoming week. And so did we. It was nice the way you involved us in your research journey. Finally, let me again congratulate you, Dr. Presley, with your powerful achievement also on behalf of Milena. Your research has filled an important empty gap in our knowledge on medication adherence. I also want to take the opportunity to thank the members of the assessment committee, both here present and online, for their efforts and work in evaluating your thesis and providing opposition here today. And finally, I want to extend my congratulations to everyone present here today and everyone who has taken the time to watch the live stream and virtually celebrate this joyful event here with you today.
Dear Dr. Presley, then it's my honor and pleasure to congratulate you on behalf of the Board of Deans of this university and of course of the whole academic community here. I always add some personal comments as well. So if you allow me, the cheerfulness that Professor Groot mentioned was immediately validated by your roommate because he was nodding all the time, which means that even in the absence of Professor Groot, you remain cheerful about all their comments and the things that happened to you, which is a good thing, of course. And then your answer to Professor Scholz's question was that the physicians are the next step. I think your recommendations or the findings can be translated in some kind of innovative program, regulations or rules or procedures. And I think the evaluations of those should be the next step, which is an academic exercise. Now that you are an acknowledged researcher, maybe this would be the next step for you too. You're already a lecturer in Surabaya at the Center for Medical Information and Pharmaceutical Care. So I think you have all the opportunities to make your academic career even more of a success. Then my final word actually goes to Professor Groot, because I just learned from him actually that this is the 50th PhD candidate that has successfully completed the trajectory, and that is really a good accomplishment. Be proud of being the 50th, and you be proud of the 50 that you have already been able to supervise. And this is really the final word. My congratulations also to the family and to friends and all the other persons present online or here in the hall. For those in the hall, now we get to, just domestic regulations. Those in the hall, I would like to ask you to leave the room before us, because then we could exchange some private congratulations from the online guests with the new doctor. So if you go and you could follow one of the people from Maastricht, and then shortly we will follow, and then you will have the opportunity also to congratulate Bobby Presley.
Maastricht University would like to extend warm congratulations to the PhD candidate and their supervisors on a successful PhD defense. Thank you for joining us. Thank you for watching.